Breast augmentation is done as follows. There are three ways to make the incision. You can make it under the arm, you can make it around the areola, and you can make it in the breast fold. I far prefer the breast fold incision. Under the arm, if you lift your arm on the beach, everybody can see that scar and they know what it means. Around the areola, you can lose sensation and you can interfere with nursing a child, and sometimes those scars are very visible. So I much prefer the incision in the breast fold. For a saline implant, it's slightly more than an inch. It's about 3 centimeters. And with a silicone gel, it depends on the size of the implant you're using, but it's usually not more than 4 or 5 centimeters, which is basically 2 inches long. The incision is made, then you lift up under the breast. I strongly oppose putting the implant under the muscle. I'll explain that in a minute. The implant goes in back of the breast, and it brings all of the patient's own breast tissue forward. It does not interfere with sensation, with nipple erection, or with nursing a child. After the implant is in place, then we make sure that, of course, that there is no bleeding, and suture the incision back. The healing process is basically a week when the sutures come out. Now, what did I say? Okay, now let's talk about the procedure. Right, so there are two places to put the implant. You can put it under the muscle, or you can put it over the muscle. Putting it under the muscle, most of the time you have to cut the muscle. And what happens is, when you cut the muscle dies. So there's no reason to put it under the muscle. You get a partial loss of the muscle. Sometimes what's left of the muscle, you flex your arm and the implant pops up. I used to think that it made less capsular contracture, less firmness if you put it under the muscle. That is positively not true in my opinion. And I see no reason to put the implants under the muscle. They look perfectly natural over the muscle if you don't put in too big an implant, if you have good judgment. And patients are much happier not having their muscle torn and not having to lie in bed for a week with severe pain. Patients complain about the elephant on their chests, walking across their chest. With doing it over the muscle, you can go back to work 3 days after the operation. Furthermore, all right, let's stop for a second. Is there a question about breast lift in there? Okay. One of the advantages of putting it over the muscle is that if there is any drooping of the breast, the implant will lift the breast. If it's done over the muscle. If it's done under the muscle, there is no breast lift. So since a breast lift leaves extensive scarring most of the time, not always, I do my breast lifts using implants. And you can get a remarkable lift putting an implant in front of the muscle without the usual extensive scarring associated with what I would call a true breast lift or mastopexy.